Good morning, everybody. It's 8:30, and we'll call this morning's meeting to order. The first item this morning is the approval of the agenda.
Second.
A motion by Commissioner Gross, second by Commissioner Cayley. Any further comments? Seeing none, all in favor signify by saying aye.
Aye.
Oh, excuse me. Roll call vote, please. Let me explain for our public. So when we have during this pandemic, if we have a commissioner off-site attending virtually, we are required to hold all votes by roll call, so. Go ahead, Kelly.
Aye.
Aye.
Commissioner Mojo,
Aye.
Commissioner Campbell,
Aye.
Commissioner Ettinger.
Aye.
Very good, thank you. Citizens to be heard. Steve, any online today?
No, Mr. Chair.
All right. We'll move on then to the approval of the bills and vouchers.
Move approval of the bills and vouchers.
Second.
We have a motion by Commissioner Haley, second by Commissioner Ebinger. Any further discussion? Seeing none, roll call vote, please.
Commissioner Cayley,
Aye.
Commissioner Gross,
Aye.
Commissioner Mojo,
Aye.
Commissioner Campbell,
Aye.
Commissioner Ettinger.
Aye.
Very good, that motion carries. We'll move on to our 8:35, our weekly update on COVID-19 with Public Health Director Kathy McKay. She's, okay, and Jamie, do you want to?
So maybe what I'll do while she's doing some handouts is I can talk about a couple of things that we have made some changes. Would that be okay?
Sure, yeah, feel free to do that. Good morning.
Okay, so one of the things that we're working on, the Minnesota has the COVID vaccine connector, which has, for the first time this week, connected with local public health. And so Kathy did actually receive over 500 65 and over names that came to us. So yesterday, what we were able to do is actually all of those over 500 names had an email except for 10. So the 10 we called, and the ones with an email address, we were able to export and send an email and let them know that they could register for a vaccine on our website. So that was nice to make that connection with that state vaccine connector yesterday. And then the other thing we're working on too is to have a vaccine sign-up form on the on the county website. And we're hoping to finish that up with IT today. And with that, people can go and register. And so then we will able to reach out to them by email, mass email, with export in order to let them know you're eligible for a vaccine and you can register. So we would share the link with them for Prevmont for our vaccine clinics as well. So 2 ways, we'll get the list from the state. However, that is, most of the people on that list had been vaccinated. But then also to allow people to do that on our county website too, so they can go on. It's kind of like we call it a sign up. And so then if they're eligible for the vaccine, then we can send them an email saying, here's a link, you can register. And for anyone who can't, then they can call us. So that should be hopefully finished up today. So I thought I'll start.
So Jamie, is that sign up going to be for anybody?
It will be, so that anyone, and then what
Then
we'll
within
do.
there, how will you?
They actually, there's a drop down with all of the phases and all of the descriptions in
Okay,
that.
and they have to kind of answer those questions, and it'll put them into their, whether they're 1C
Category.
or whatever.
Exactly. So that's what IT is putting in there right now, all the descriptives that that they'll be able to choose which category. So then if it's 1C, then we would notify all 1Cs you're eligible to sign up now, so.
Okay. Dave?
Could you guys get that link out to us? I've got an awful lot of people that have been asking me, and I'd like to just get them hooked up to that link, particularly if it's all groups, all classes. They can at least feel like they're in line when the time comes.
Yes.
Yeah, maybe that can,
So 2 things, we
can
have
IT
some.
just send that to all of the commissioners.
Yep.
2 things, we do have some clinics open right now, and so that's on the website, and we could share that, but also the link for this sign-up as well.
Right now, we're 65 and over.
as of today.
as of
Correct.
today.
K-12 and childcare providers.
And higher ed's not in there yet.
The what?
Higher ed,
Higher ed is not. We've asked that question of MDH of what tier they're going to be in, and we haven't gotten a direct answer, but higher ed is not in there unless they're meeting that 65 and older.
thanks.
So, good morning.
Morning, Kathy.
Sorry, I grabbed last week's information, and I'm sure that's not what you wanted to see, a repeat of last week, so apologize for that delay. Need some quick copies for this week. So you can see the number of active cases actually is at 120 now for this week, so we went up a little bit. During the month of February, it was 69, 46, 51. Then we jumped up at the end of, or at the first week of March to 106, and now it's 120. And I know there was some groups that were sports groups and other activity groups that there was some cases that erupted. So we have a few more cases in that regard. We have an additional death, so we are at 88 right now. And then our 14-day case rate, to note, that's up a bit. We were down in the 32, 21, 14. Now we're up. We dropped down last week. We're up again 14.97, but it's pretty consistent with our active cases. So not too alarming. The case, active cases by age, of course, the graph on that second page is going to vary based on the age group. So we do have the 20 to 24, which is still our highest now for the active cases this week, and then the 15 to 19 is another group that's consistent with the sporting events that we're noticing some spread. In the cumulative age ranges, it's still the 20 to 24 that remains of the highest age group. And then hospitalizations and deaths have been pretty consistently manageable. There's no uptick in those numbers that are alarming to the based on the number of active cases and things that we're seeing. I think. I'll talk about this in a minute. I think we missed a page that should have been copied. The saliva testing site is still open. We still don't have a date when that's going to end, so they continue to do the testing. Through the month of February, we've been consistent with, anywhere from 1,600 to 1,700 that are getting tested. We have a breakdown of the Minnesota residents, and the majority of those averages about 1,070 of each week that Minnesota residents get tested, and then we have like 500 to 580 of non-Minnesota residents. So most of those would be the North Dakota ones that are coming over and taking advantage of that saliva testing site. So that continues, and no word yet.
Who do you recommend should be using that site?
Well, we do recommend that for those that aren't vaccinated at this time, and they become symptomatic, you definitely should get tested because the virus is still circulating. We don't have the majority of people are not vaccinated yet. So we really, those that are concerned about an exposure, we also recommend those that have done some travel. It's not required, but we really, especially if it's international travel, and we've had some questions about that. So some people are doing international travel, and we really recommend getting tested because you're just not sure after that travel. We've had some questions about, quarantining for a few days after travel. It's not required. So if you get tested, and then as long as you're asymptomatic, we tell people you can go back to work. You just have to, the minute you become symptomatic, you need to stay home. So those are the people we're really recommending go to the testing site if you have a concern at all, especially if you've been around, if an individual is not vaccinated and you've been around other people that aren't vaccinated, for sure, get tested. That answer your question?
I think it does, yeah.
Okay.
I guess I was asking it for others too.
Sure.
Myself.
So I'll let Jamie, before we move on to some of the other points, I'll let Jamie talk about, and maybe, did you cover that already when I was gone?
No, I just talked about the connector.
Okay, okay.
Jamie, is your microphone on?
The light is on.
Okay.
Am I standing too, or sitting too?
She has such a soft voice, she's got to be louder like I am.
Okay, so what did you want me to cover now?
Oh, did you talk about the vaccination, our clinics?
Okay, so in Clay County, basically with the vaccination administration data, we are at the total number of people with at least one dose of vaccine. We're at 17.4% of the county population as opposed to the state of Minnesota at 19.3% of the population. Total number of people with completed vaccine series is 9% in Clay County and 10.6 statewide in Minnesota. And then people aged 50 to 64 with at least one dose of vaccine, 20.2% in Minnesota, 20.2 in Clay County and 17.3 in Minnesota. And then people aged 65 with at least one dose of vaccine, we're at 64.8 in Clay County and 65.9% in Minnesota. And the goal for the governor of Minnesota is 70% before moving to the next phase. Excuse me. And then the cumulative number of doses by Clay County Public Health only is 6,888. And then you've got the graph of our weekly doses down at the bottom. And then just to let you know, for this last week was a challenge for most of the counties and providers because we are getting to be pretty saturated with that 65 and over population that have not been vaccinated. And so we did do less doses, but we had the opportunity with providers and public health to move vaccines. So people were getting it where it was needed. So a lot of that shifting was going on. So because of that, and still being in that 65 plus, and our schools are done, our childcare is done, and our healthcare providers, except for a few that we are continuing to invite. So with that, we did reduce less doses, with the comment that if they open it up, we'd like to receive more, but otherwise, we would have to focus on that population. So we will be, this week, giving just 500 first doses. And then we have 400 second doses. So that's quite down for us for this week compared to what we've been doing. And do you want me to talk about this?
Oh, sure.
Okay. So last week, we kind of did an introductory to the phases that the governor of Minnesota has shared. And this, one of the attachments in your packet is a more detailed kind of spell out of that. We're hearing that based on the challenges last week, that there would be a potential for opening up to the next level. So this shows, with Phase 1B, Tier 1, which is where we are right now with our childcare and schools and 65 plus, then moving into Phase 1B, Tier 2. And that's where we would really be focusing primarily on those that have health conditions, and it's very spelled out in here. The Commissioner of Health mentioned yesterday that those are individuals that are very well connected to their healthcare providers and anticipating that they'll move through that group real quickly because of that. And then also, we talked a little bit about manufacturing and food processing, and that would be a group that we would be working with the essential workers at the same time. And then Phase 3 is where we move into the older individuals, 45 to 64, with one or more underlying medical conditions. And then also people aged 16 to 18, or 18 to 44 with two or more underlying conditions, and those two. And when we talked about that sign-up sheet, that's exactly what's dropping down, the details of that. And then moving into Tier C is, and this is guidance from the CDC and what MDH is looking at, that we continue to try to focus on those with chronic health conditions, as we will be doing both, just like we did, healthcare workers at the same time that we were doing nursing home and assisted living individuals that were most at risk for complications from the virus if they were ill. We will be doing that same kind of prioritizing those with chronic health conditions primarily. And then we go into the Tier 4, and then eventually to 1C and general population. The one message is that we are moving quicker than anticipated. So hopefully, there will be plenty of vaccine and opportunities for people throughout the community to receive that vaccine.
Mr. Chair.
Who has a question? Oh, Jenny, go ahead.
Thank you. I did see that there's a press conference this morning and that the governor is anticipating opening it up to that next phase tomorrow. Have you heard that?
We have. I just didn't know if we were able to share that.
Sorry.
No.
My next question would be, what is our threshold for capacity in terms of administering vaccinations? I see that we've got 900 this week, and we've had more or less. Staff-wise, what is your capacity?
And, sorry, Kathy. were you
No,
gonna-
go ahead. No, that's fine.
We are in the process of working with HR to bring on some people to help us with vaccinating, just simply for that process. Our staff, our nurses are doing a lot of the vaccinating. However, we do have a lot of the students from the universities around us who are assisting us. But what we do on a weekly basis is we report to the State Health Department on what our capacity is. And the most we've asked for has been 1,700 in a week because of the fact that we've got that 72-hour turnaround time. And so that's really what's causing the limitations for us, is that 72-hour turnaround time.
So the site that you use is capable of handling 1,700 a week in terms of just the logistics and,
Yeah,
okay, so that's been working good.
that's been working very well, yes.
Commissioner Mojo, do you have any other questions?
Yeah, and my follow-up would just be, as a county board, is there anything, as we look forward to the possibility of getting more as the availability becomes, what do you need from us in order to vaccinate more people?
Well, it'll be helpful once we finish the onboarding of all of the nurses that have applied to assist us. Some of them are very limited because they have jobs elsewhere, so they've offered to assist maybe in the later part of the day or on the weekends. So I think that capacity, as we onboard we're starting with the RNs. We also have LPNs that have applied, so we can utilize those as well. So that will be extremely helpful in being able to get that vaccine out, and then to give our nurses a little bit of relief so they can keep up with their other obligations. The site is great right now. We potentially don't know what the needs will be with the city and with that YEMCOM site. So right now it's working well. We're able to get people through there, and the setup is really nice. So maybe in the future we'll have to, keeping our eyes open if there's a need when they open up that building, if we'll need to move if we aren't quite done with our vaccination process, especially when we open it up to all the general public. So, that might be something we'll continue to look at, and then we'll work with the city about the length of time that we can utilize that site. I talked with the city manager yesterday, but I don't have a time frame yet about what they're thinking they'll need that site, where we'll need to leave. So right now there's nothing imminent for that. I did also reach out to some of our legislators. The reality is this requirement by the governor, and maybe he'll change it today, we don't know, but the requirement from the governor for a 72-hour getting the vaccine out by the time we receive it, and then in 72 hours, is really a burdensome for our citizens, and also for us. We can't get the vaccine until Tuesday, so Monday is a wasted day. We can't get vaccine out because we can't carry it over until Monday, so we have to have all the vaccine out by Friday, and that's very challenging for people that are working or having commitments to get them in to get this vaccine. So I reached out to the legislators to see if they could encourage the governor to expand that. I understand when we started that, the rollout was a bit delayed, and there was a little bit of burden. But we're at a point now where I think even if we had a 7-day requirement to get vaccine out, it would be much better for all of the people. And I'm not speaking just for Clay County, I'm speaking for the whole public health agencies across the state, because we've all expressed this concern that this 3-day limitation is really challenging. So, so I'm hoping that maybe that will change. We'll see. There's a number of people reaching out to legislators to express to the governor, it would be nice at this point to, a 7-day turnaround time should be adequate.
Commissioner Mojo, do you have any follow-ups? Okay. I want to.
No, thank you.
Thank you. In terms of the national discussion that I see, you know, there's discussion now that there's going to be enough vaccine for all adults in this country by the end of May. Just doing the math, that's not very far away. Mm-hmm. And if that indeed happens, and it becomes available, if we have the opportunity to get into more of a mass inoculation type of deal, I think we should be ready for that. And I don't know what your plans are currently. I do know that right now within the bill that's been passed through both the House and Senate, it's back at the House, and right now there's significant dollars, and I'm a little confused, and Steve, this is something to follow up on, but there's dollars that are set aside for counties and city governments. But I also noticed in that pie chart there was a separate amount for vaccination. So, but now I saw that some discussion was that the amount that might come to the counties, the vaccination dollars are included in that. So I'm a little, I think there's going to be some clarification there, but I don't think we should be afraid to make whatever plans that you need to do, because certainly the funding is going to be there to make sure that we can accomplish this. And if we have 30,000 vaccines become available for Clay County, I'd like to see us ramp that up.
Right.
And get it out, and we should be ready. And I think from our standpoint, right now, and this goes to what Commissioner Mojo said, what can the county do? Mm-hmm. I think what we need to do is tell you right now that make your plans and we'll back you.
Okay.
I think that's the important part message that we have to give right now. And I do want to say I got in and had my second shot, and everything that you guys do over there is tremendous. And I want to just, on behalf of our board, make sure that you relay to all those people that are working over there and these part-time nurses that are coming in. Make sure you tell them thank you. I happen to recognize a few of them when I went for my shot, and it was just nice to see that you have that support. And you might need a lot more. You know, I'm hoping that you will need a lot more to get this done. So, and then just back on these numbers, when we talk about the 6,808, and these percentages that you talk about, percentages of 65 and older being at 64.8% in Clay County. Are those percentages based just on vaccines provided by the county?
No, those are.
Or is that everybody?
That's everyone.
So whether they got it through Sanford, Essentia, or pharmacy, those percentages, that includes them all?
That's correct.
Okay, all right. I was curious about that.
Mm-hmm. Yep.
But the 6,888, those are just county
Correct.
Just public health.
distributions? Okay.
That's correct. Yep.
All right.
And then did you talk about the new guidance? The Center for Disease Control has some new guidance that you may have heard, it's already out there, about fully vaccinated people can now visit with other fully vaccinated people without wearing masks or physical distancing, another household. And I'm not sure if, in our haste, did you get did you get this on your handout? So it kind of shows that the changes. And then fully vaccinated household visiting with another household who is at low risk for severe COVID disease can also connect without prevention methods, so no masking and social distancing. So those are the big changes. Refraining from quarantine and testing following a known exposure if you're asymptomatic. So if you're fully vaccinated, you don't have to quarantine or test if you've been exposed as long as you have no symptoms. So that's another big change that the CDC had just, they just put that out yesterday. And so, but fully vaccinated people should continue to, when they're in public, you still need to wear your masks, social distance, and if you're with unvaccinated people from multiple households, you're still required to wear your mask. That continues to be the same. Avoiding the medium and large size gatherings, and get tested if you're symptomatic, experiencing COVID symptoms. So a few changes at least that's been interesting that the CDC has decided to make that change. So we still know that the COVID vaccines are effective for preventing illness and death. So we know that. We're still not sure how effective they are against the variant strains. They're still researching that. They're still working on how effective is this specifically against those variants. And we're still learning about how well COVID vaccines keep people from spreading this disease. So that's another thing that they're still working on that data. And we're still learning how long the COVID vaccine will be effective. So how long will that be effective to protect people? So there's still some unknowns that the researchers are still working on, but this is a positive thing that after research that they've decided if you're fully vaccinated, you can connect with others that are fully vaccinated. You are not fully immune until, of course, 2 weeks following your second vaccination. We don't have Johnson & Johnson vaccine yet, so the two we still are working with is Moderna and Pfizer, and those are the 2-dose. So you're not fully vaccinated or fully immune until that 2 weeks after the second dose. We don't know when we'll get Johnson & Johnson. We have a request in for it, but that's still an unknown. Any questions about the CDC?
Commissioner Kaylee.
I have a question about the vaccines. Can you talk about the difference between how the Pfizer and Moderna vaccine work and how the Johnson & Johnson vaccine works? As far as one is, the mRNA is Pfizer and Moderna, and then the Johnson & Johnson is, what is that word? A vector vaccine, is that what that's called?
I don't know if we have all of that information specifically that you may be asking. What they're recommending, of course, and this is out there, is get the vaccine that's available. The Moderna and the Pfizer are up to 95% effective after that second dose. The Johnson & Johnson is a little less after the first dose. It's a little less effective.
Only dose.
Yeah, the 1 dose, sorry, the Johnson & Johnson 1 dose is a little less effective, but still highly effective against illness and death, so the severe illness and death. I'm not sure the side effects for Johnson & Johnson, they're saying are pretty close to what we're seeing with Moderna and Pfizer. That, you know, there's a wide variant of people that have fever, chills, headache, body aches. Some get it from the first dose of Moderna and Pfizer, some get it from the second dose. Some are pretty significant, other people have less effects, and so it varies. The sore arm is pretty common. Johnson & Johnson, apparently, the people that have received it are experiencing some of the same effects of that. But I don't have the specifics on what you're asking. But we can get that information for you.
Probably not a huge priority as we don't have it in the area anyway.
Yeah, I think the critical piece is to get what's available to you.
Right, and there is, I've read some things about how Johnson & Johnson has been exposed to some of these variants in these tests, so that could be one of the reason why it's showing a slightly lower efficacy. But since it has been exposed to those variants, it's still highly beneficial, so.
Yes, absolutely.
And one question. Some people I know I've talked to, they've taken the first shot and they've gotten fairly ill from it. So they're not planning on taking the second shot. Is that, what's your advice to them? Is that take it or?
You know, if there's some real significant, you know, we talk about an anaphylactic reaction, which is different than some of the responses that they are, you know, they're getting the headache, the fever, body aches, chills, which is, you know, it's not fun to go through experiencing that 24 to even 48 hours afterwards. If there's a concern if they should take their second dose, we really recommend they reach out to their provider if they think there may be a reason not to receive that, but just know that it is pretty common to get some of these side effects. So I know people are concerned when they get side effects from the first dose. So if you have some health concerns and really are concerned, we recommend that you get the second dose because, again, only after the first dose you're about 50% protected, which isn't giving you enough immunity. So if you can get that second dose at all, that's really what we recommend that people do. But if they feel like there may be a concern with conditions that they may already have, they really should reach out to their healthcare provider. Some people we've recommended them to do that, just to get confirmation that they don't feel uncomfortable getting that second dose because their physician or nurse practitioner recommended them to continue that. But there are some conditions, I know of only one throughout all of this where the physician really recommended not to get that second dose, but that person had a pretty significant reaction. Does that help?
One last question that I have, and I'm asking it for a friend. Once you've been vaccinated, can you test positive for COVID?
Once you've had the dose.
Yeah, once you've gotten the vaccine, can you test positive for COVID?
You know,
From the vaccine itself?
or you know, I'm not aware of, because the recommendations are you really don't need to get tested and probably shouldn't get tested once you've had the 2 doses
Well, but
of
there's
vaccine.
times when you have to, for example.
Well, if you're symptomatic,
Well, or if you travel to
that's true.
another
Yep.
country. You may have been vaccinated when you left, and in order to come back, you still have to be tested. And so that's where the question came from. Can you test positive after being vaccinated from the vaccine itself?
That is a good question. I'm not sure about the answer to that.
Okay, that's another one you can look into.
We'll have to look that up. Yeah, I wasn't,
So so even when our commissioner here decides he's gonna go to Hawaii, which is gonna,
not to point him out,
Does he,
but
does he need to be tested, and will it keep him over there for a while?
I think,
Oh, I hope.
I think he has to stay there a couple months in quarantine. We will definitely find out the answer to those questions.
No, I literally am asking that for somebody else who's.
Absolutely. We'll get that information out and we can even post it as well.
Okay.
Because I'm not quite positive about if you're tested positive, if you have the 2 doses, so.
I know that people who had COVID for a certain period of time they can still test positive because of antibodies or something, but,
right.
so.
Yep, good question.
That's very good.
Okay.
We'll research that, we'll get our experts on that and find out.
Once again, thank you both, and
Thank you
thank
very
all
much.
of your staff for all the continued good work that's being done. Clay County is, we're proud of our public health department here, so.
Thank you very much, appreciate that.
Thank you.
Okay. We have a request to waive penalties on late payment of taxes. Michelle is here this morning. Do we have the person online or anything that's the request? No? Okay. And again, maybe just for, again, for our new commissioners, we had established in the past certain criteria that would even allow these requests to come before the board. I don't know if you're aware of that or not. Okay. And so in order for it to even be here, that request probably has met certain criteria that we have, right, Michelle? Okay. Okay, so we do have a attachment C in our packet. It doesn't get to be real descriptive of why, but do you know any more than what's there, Michelle?
Nope, that he just sent this email and we forwarded it on to the board because, I mean, they're just saying because of COVID, it's been a difficult year, like it has been for a lot of people. He did set up bill pay. We haven't received the payment yet and paid the interest, but is requesting the penalty be waived.
No, I guess what I read from this is just, she says it's been, he or she, this has been a difficult year. And I know, our requests say, in the event of property owner's serious illness, hospitalization, or death, or in the event of disasters. Well, I guess you can figure COVID-19 is probably a disaster, but there's nothing on here saying that it's connected to anything to that. So I was just wondering whether we need more documentation, or we're gonna get more requests just to say, hey, there's COVID-19 going on, that's why I didn't pay my taxes. There's no documentation saying that they had problems or why. I mean, I'm not that I'm against forgiving, we've done them almost weekly here lately, but this one has no documentation with it. Is there, I mean, do you have any type of document?
No, this came through our treasurer site and got forwarded to Clean, so I didn't speak with the gentleman, but I can definitely reply to him and ask him for more information.
I mean, I'm just saying that we're opening up ourselves for every claim.
I do agree with Commissioner Gross. I just, I'm not suggesting that we deny this right now, but I'm suggesting that maybe we send back saying that we need a little bit more detail as to what the reasoning for the request. The entire country has dealt with COVID, and we still have to pay property taxes.
Yes.
Agreed. I would like to table it for more information.
Go ahead.
Just in addition to that, I would have a concern that if we do grant the suspension of the penalty, that be contingent on the payment of the tax.
Oh,
And that's not happened yet either.
right.
And that's usually a stipulation we will put on.
Yeah.
I did look it up before I came upstairs, and it looked like, under his name, his home is paid with escrow, and this is looked like a business name, so I can definitely send him an email and tell him that the board wants more of an explanation.
Yeah, if we can get a little bit more clarification.
Yeah, I don't know, I think I'd like to, I don't know whether you table it or whatever you want to do, but I'd like to put this off for another, get some sort of documentation from the person that, what happened? Yeah, we know COVID-19 happened, but is that the problem, or, and I'm not trying to pick on this person, I don't know who this person is. I'm just, don't want to open ourselves up to a policy where we're going to forgive everybody their penalties for not paying taxes.
I don't know, Steve, if we actually need to table this. I think we can just request that it go back for further information. Okay, tabling it, typically the tabling requires a time specific for return. And I'm thinking that we should be able to get this by next week, but in the event that we can't, I just, if it's okay with the board, maybe we can just instruct Michelle to ask for further clarification before a decision can be made.
Okay.
Is that okay?
Mr. Chair,
Yes, Jenny?
I may also request for this and any others. I think it's important for citizens, the individuals requesting to be present in any capacity, whether at a phone call or virtual or in person. I think it's too vague if we don't have a personal story from the individual. I'd also like to see what the history in terms of taxes are, if there's a history of late payments or not.
Or those are good. The only thing about the in-person that I would question is if you have somebody who's, because of the times that we meet, there's an awful lot of people who have to be in their own job settings at that particular time, and they might not have the ability to, with whatever their job requirements are, to step away from what they're doing to even do it virtually or what have you. So that part, it certainly is, I think we should encourage them to try to attend in person or virtually, but I don't know that we should make it a mandatory situation. Commissioner Ebinger.
And maybe,
I think,
Go ahead, Jenny.
I said maybe I misspoke. I don't believe I heard that there was a personal contact at all with this person. It just sounded like it was a request made on the website, and that's maybe where my comment came from, so I appreciate it.
Okay.
that's, in absence of somebody having the capacity to respond virtually or in person, if staff that had talked to this individual and had gotten the information, if a staff member could be present, that would be fine too, but I agree, this isn't enough for us to make a decision.
All right, I think with that, Michelle, I think the direction will be for you to contact them and
Okay.
just tell them we need more information.
Okay,
And then we can act on it. Thank you.
thank you.
All right. Joel Olson, you're going to give us an update.
Yep.
Facilities update.
I have a quick map to give you guys real quick. Sorry for last minute. All right.
I think they're working on getting you an electronic one, Commissioner Mojo.
Yes, I apologize, Commissioner Mojo, on that.
Okay, Joe, good morning and welcome, and
Yes.
you have the floor.
Yep. Okay, yes. Good morning, Mr. Chair, board members. I'll try not to get too fancy on you today. We're kind of in the middle of a restructuring in our department, so I'm trying to figure out how everything goes. But I guess in the past, I'd like to start out with saying that I'm used to having Georgia next to me. She served 30 plus years, not sure the exact, but over 30, and I just appreciate all her work, and it's weird to have her not next to me, so she did a real good job of leaving a roadmap of things she does, so she's missed anyway, so thank you to Georgia. Another thing is I appreciate the board's support on the new restructure that we're currently doing right now, so it's going well. Right now, I had put Brian Friedrich in place as the operations supervisor under me, and then we've also put Betty Hansen as the administrative assistant and runs the mailroom. And then Brian has hired Janelyn Roethlisberger as the lead custodian at nighttime. So we have all the pieces in place right now, and we're starting to learn kind of the new system, and it's going real well. So thanks to both Brian and Betty, they've stepped in and really made the chaos go away
Why
during
don't
this.
you bring them in sometime and introduce them?
Yes, and I'll do that, and then I know moving forward, I'll probably have them at the annual updates too as well, so, yeah, other than that, with the new, with Brian becoming new operations supervisor, we have a new maintenance employee coming on in a couple weeks, so that's happening there, and we should be full staff, so. With the maintenance department, we currently, right now, we have 5 full-time employees and 1 variable hour. And with the custodians, we have 7 full-timers and 2 permanent part-timers and 14 variables. So, one of Brian and our goal is to figure out with the custodians. We use a lot of variable hours. We like that. It works well. But there's a lot of turnover there, so we'd like to try to analyze that and see, how we could, minimize that more, but that's been working real well there, so. Other than that, that's the departments there. Family Service Center, so what I've handed out is a map here, and basically just information only. It's basically telling you everything from, who rents what in the Family Service Center, what the costs, or what the rent costs are per department, and just kind of an informational. I didn't plan on getting into the specifics of it, but letting you see who rents what and stuff. So if you have any questions on that, and other than that, that's what that is. The building is 100% occupied right now. Looks to be, other than one little 90 square foot space. We've had some space request needs from both county and tenants. Some of those needs I plan on bringing to the building committee to discuss and try to figure out something there. But yeah, so that's basically the Family Service Center there. Like I say, the map's for you to just take a look at and understand who's there. So as far as the mailroom, right now Betty's been running the mailroom. It's been working real well. She had the opportunity to train with Georgia for quite some time on it, so nothing new to her. She's been doing good there. We're looking at adding a different carrier, or not a different, an extra carrier system now, where the maintenance will go out to the government center now, and we're kind of revamping how we pick up the mail and everything. Doesn't change on the end user part of it all, but and we're also looking at currently right now we do the mail in-house. We rent a machine and everything. We've done the budget analysis on what it costs to hire out the mail, and when I say that, we already hire out the mail 50% right now, and so we figured out it's cheaper to have outsourced fully the whole mail, and then that I don't have to hire a backup or anything. So we're looking at analyzing that as well, but again, nothing changing on the end user on how the mail and everything is distributed. So fleet vehicles, we have 17 fleet vehicles right now. We currently own half and lease half. That's one of those I'm looking at to see, would like COVID to kind of fade away, to see exactly what our needs are on how many fleets we need there. So other than that, government center project's going well. I think 29th is our target date. I think we finished up Steve's area pretty close. We're getting there. So yeah, we look to move in on the 29th there. Tom Millette, he's a maintenance guy here, and I just want to bring his name up because I've systematically watched him put together and take down all those workstations over there. Definitely needs the credit there. He's working with departments to design their areas, and he's just been every day going at it, and the whole maintenance crew's been doing well. So other than that, working on the capital improvement plan, and hope to come back there. The engineers are helping me with that plan. I hope to come back there sometime in April with a cost analysis of that. And other than that, didn't want to get too deep here, so any questions for me?
Joe, on the capital improvement piece, on the area of, with the potential land swap that's been discussed, where are you at with determining replacement of that and future needs? What's your process been for that, and where are you at?
Where I'm at now is I met with the sheriff's department, and we've designed a building that we feel is that we need. I've turned that over to some contractors to get some pricing on that. If that is a possibility, that'd be definitely a bid project, but going to get some numbers for you guys. Hope to have come back probably, I was hoping by the 23rd in the next couple weeks, but hoping within a week I'll have the numbers and everything as well. So that's where I'm at right there on that.
We have a meeting scheduled?
We don't. I'll reach out to Steve and we'll get something planned.
Any other questions? So, thank you and your staff for all your work that's involved with this move. It's, once again, I think it's saving our taxpayers a lot of money by you're doing that internally. It's excellent, and I think all of our staff certainly appreciates the way you're going about it.
Yep.
So make sure you give all of your people a big thank you from us.
Will do.
I think if you've gone over there, I went over there yesterday and looked around, and there has been a lot of work done on that building and a lot of stuff moved around. It almost looks like now every time you move one thing, you gotta move 10 other things to make room for it. But there's a lot of work ahead for you, and there's been a lot of work done, and I agree with Commissioner Campbell that thank you very much for what you're doing there. That looks like quite a challenge over there.
Hopefully 29th it'll be close to over for us.
If you're looking at something for that week of the 22nd,
Yep.
I can tell you right now, the 22nd works best for me.
Sure.
Just looking at my calendar, that week
Yep.
it's full, so, but I think if we can have something the 22nd, if that works for
Okay.
Commissioner Groves.
Yep, I'll reach out to Steve here and we'll.
Yeah, okay.
plan.
Anything else, any other questions? All right. Thank you, Joe.
All right, thank you.
Mr. Dent, Technology Services Director update.
Morning.
This will be your last one, I suppose, huh?
This will be my last one. That's correct.
So usually everybody that comes in here and they say that, they got a big grin on their face. I see it's hard for you to hide yours.
No, I definitely have some mixed emotions.
Yeah,
about leaving. I work with some great people over here, so it's tough.
Well, over the years, I've certainly enjoyed working with you too on your group. It's been good.
Good bunch of people.
Yeah.
Got a PowerPoint hidden behind. There it is right there. Dazzle you with 6 PowerPoint slides today.
Now, I can't imagine somebody in technology services, we're gonna have trouble with it.
No,
With the
I know, I can
PowerPoint
call some
presentation.
folks right over here to come and help me when I have problems, so. I'm not sure if Commissioner Mojo can see this presentation.
Commissioner Mojo, can you see his presentation?
I can, thank you.
Okay. All right, so I'm the Technology Services Director at Clay County. Been here 31 and a half years, and like you said, this will be my last year, or last update. May 7th will be my last official day at the county.
Can you get your microphone just a little closer to
Sure can. Okay, so our mission, Technology Services, is to emphasize the delivery of high-quality customer service in a cost-effective manner, responsible for strategic and operational planning related to technology and its use by the county. Our department is comprised of nine full-time employees. Myself, we have 4 systems administrators and 4 computer support specialists. And if you remember, we had 3 systems administrators last year, and we were able to add 1 on our staff this year. And what we did is we promoted one of our computer support folks to that position, and he is currently in there. So we have 1 vacancy in our computer support side, and we hope to be interviewing next week to fill that position. Kind of an outline of what our systems administrators do. I know it's only 5 lines, but it could be 1,000 lines if I broke each one of these out. Managing the networking infrastructure is probably the biggie there. These folks are responsible from anywhere from managing the servers, firewalls, the switches, the access points, the county phone system, and also helping out with the more complicated tech support calls in. They also manage all of our large applications and databases. They're responsible for the county security, like our Know Before system that I'm sure you've all have encountered lately, where we're training our staff not to fall for phishing scams and things like that. And it's been incredibly successful, in my opinion. You can just see on our tests, our numbers have dropped, I think, from over 50% failure rate on our first testing down to, I believe the last one was less than 1%. So very, very effective. Like I said, they manage the firewall, our encryption, our multi-factor systems. They manage all the backup, disaster recovery, and also, like I said, they're backup support to our county employees for technical problems. Okay, our computer support specialists, they're our first line when we're having issues. We have a help desk line that the county employees call, or they'll put in a help desk ticket into the help desk. They manage all the inventory, the assets, and the supplies. They schedule our ITV centers, and they're responsible for deploying all the desktops, laptops, phones, printers, scanners, and a million other things, and deploying software and the support of all the software. So the last year was a pretty exciting year, I guess, for IT. I think it was for everybody, and our office was no exception. I think it was about this time last year, a bomb kind of went off, and we got incredibly busy in IT. I think it was within a week of me telling the staff that 2020 was going to be a slow year. It was going to be a catch-up year. We were going to catch up on all of our projects and this and that, and it absolutely went the exact opposite of that. The mobile deployment that we pushed out last year around this time, well, the entire year was just incredible. We had, we did have a lot of laptops in the field already. A lot of it was, they had a desktop under their desk, and they used it occasionally. So we had a lot of those coming in some of them hadn't been turned on for a long time. They needed updated. Plus, we were trying to deploy new laptops out. Folks, we were pulling laptops out of our training centers, every place that we could pull these laptops out of to get them out. And they were incredibly difficult to get last year. So then when we finally started getting the new ones in, we started replacing our old ones replacing the old ones with the new ones. And we're still in the process of doing that. There's some departments that have not gotten the new laptops yet, but we're still working on that.
Is that part of the, still part of the CARES dollars?
Yes. Yeah. They're getting close to getting all the departments done. You try to prioritize, employees on who needs them the most and or who's working more at home too than they are in the office. And so staff did a really good job of training these folks on how to use this stuff at home too. You know, it's a matter of handing them a laptop, you know, how to securely attach, you know, either through the VPN or to remote into their own desktop. And it was quite a change for most people. We made a lot of improvements to our wireless access since we were giving a lot of departments laptops. We didn't want to overwhelm our wireless infrastructure in the buildings. We upgraded our collaboration software from Skype to Teams during this. We implemented Jabber, which is a way that people could use their laptops as their desk phones while they're at home, so they could mimic being in the office. We had to make a lot of firewall changes to accommodate the work from home. We had to upgrade a bunch of licensing for our VPN licensing for the work from home people. And we also moved the DMV office during this time and the new government center, which I think we have four staff out there right now, moving the HR department. They moved central admin yesterday, and they'll be doing that probably all month. We'll have a staff working out there moving our departments. So that's all I have on my slides.
I want to say that, you know, it certainly was kind of a big bombshell that went off for your department especially. But between what you and your staff has done with success, in the future, it's allowed us as a county to really feel confident in potential new ways of providing service to our clients. You know, you've proven that bricks and mortar isn't everything, you know, in terms of where we staff people, and I think that's probably a good thing. So,
Yeah.
But you guys have done a tremendous job.
Thank you. Yeah, this staff barely batted an eye when this came up. I mean, you know, our department is used to change. I mean, things change every year for us. I mean, not at this level of change, obviously, but I mean, these folks just jumped right in and just went right at it, and it was incredible what these guys accomplished over there. So.
What Tim didn't tell you guys either is that just before this, when he was hoping for a slowdown year, because just before that we had the new law enforcement center, we had the correctional facility, we had changes to our juvenile detention facility. All of those things went on at the same, you know, just prior to this, and your department had to I mean, you were the ones who took care of the guts of the operation, and so it hasn't been slow.
No, and I stopped making predictions now.
Yeah.
And when Rory Schmitz started, I think 15 years ago, I told him, you know, it's not always this busy. It's going to. We just got to get over this hump, and then it's going to slow down. So 15 minutes later, I think he's still waiting for that to happen, and sorry.
All right. Any questions from board members? Yes, go ahead.
Just one observation, Tim. Being a new guy, in both myself and Commissioner Cayley have not seen all the accomplishments that have been described here today, but just the experience of coming on board and having been an employee in different capacities in different municipalities before this, I've never had as smooth a transition of coming in and getting the technology to us and having people available who quickly help us when we have a problem. And I'm grateful for that. That's made coming on board here much easier for us. So I want to let you know, appreciate you and your staff for the efforts that you've done.
Thank you.
All right. Thank you, Tim.
Okay, thank you.
Best of luck to you.
Okay, thank you.
All right, next we have our annual update from Child and Family Services Division. Rhonda, you want to give your introductions to your folks here?
Third and final. Good morning, Mr. Chair, Commissioners.
Good morning, and we're running late, and that's not your fault.
Okay, good. I've been a little sensitive with that. Oh. All right. I think you did get the handout, the PowerPoint for today.
Yes, we did.
All right. And I did email it to Commissioner Mojo, so I'm hoping she has it as well.
Okay, Commissioner Mojo, do you have the handout, the PowerPoint?
Yes,
All right.
yes,
All right,
thank you.
you're good?
Okay, well, I'm going to let these three experts handle this. We have Quinn Jager, he's our supervisor in our assessment unit, Amy Amundson, ongoing child protection, and Michelle Thordal, also ongoing child protection and children's mental health. So, let them take over.
All right, who's going first? Who's on second?
I'm going to start us out just to give the brief overview of our Children and Families Division. As Rhonda mentioned, Quinn Jager supervised our child intake and assessment, which is just kind of the very beginning point of entry into our division. And then I supervise ongoing child protection case management where it's been deemed that a family is in need of services, and so we offer case management services to those families. And Michelle also supervises ongoing child protection case management as well as children's mental health, some CADI CADI services for children in addition. And so Quinn supervises 11 full-time employees. I supervise 11 full-time employees and 1 variable hour case aide. And Michelle supervises 8 full-time employees and contracted mental health providers. So going on to the next slide, we have 2 intake workers, 8 assessors, which are child protection assessment workers who go out, initially make contact with families and assess the report that's been made, 14 case managers providing various services, 5 case aides, and then our 3 supervisors. So the services that we provide to families are receiving abuse and neglect reports from the community, taking those reports, determining whether or not it meets the criteria to be screened in for a report, going out, arranging for emergency out-of-home placements due to safety, conducting child protection investigations and assessments, providing child protection, child welfare case management services to families in Clay County, whether it's voluntary or court-ordered, supervising our contracted children's mental health services, and managing services with contracted providers, including The Village, Lutheran Social Services, Lakeland Solutions, and Rainbow Bridge. And this will go fast because I'm a fast talker, so sorry about that.
We'll kind of get into a little bit of the data. I'll take over from there. So prior to COVID, we had historically gained about 100 calls for service per year. You can see in the trends there, our total overall calls had increased a little bit each year, and then COVID hit. I think one of the important things to note there is the schooling element of things. Overwhelming majority of our reports come from either law enforcement or from schools. So when kids aren't in schools, we're not getting as many calls anymore. So that's had a direct impact on our overall numbers for not only calls for service, but also in our overall caseload size as well. So we have child welfare intakes and child protection intakes. Essentially, child welfare intakes can be anything ranging from how we kind of code our probation cases, children's mental health, voluntary calls for service, and then we have our child protection intakes where someone in the community is reporting abuse or neglect from occurring. So you can see a steady incline prior to COVID. I think even before COVID hit, we were on track to have another probably 100 plus intakes from last year. So we'll see how that kind of bounces back. Now that kids are back in school again, we kind of have seen those numbers start to tick up again as well. Go ahead. Of course, with the total overall calls for service, declining because of COVID, it's had a direct correlation in the overall caseload size. So you can see we're down slightly from last year and years prior. One important distinction is that although the calls have decreased, the severity of what we're seeing has increased. Significant substance use in the community, significant mental health, both by parents and by children, has just drastically increased during these COVID times. it's hard to quantify in data to see what we're seeing and the severity of it out there. That even though our numbers are lower, the difficulty of the cases have significantly increased. Again, schools not being in session has had a huge impact on that as well. So we opened 310 assessments. You know, that's kind of the front end where we're going out figuring what is the safety concern, what do we need to help these families with, do the children need to be removed if we're not able to create plans. The child welfare assessments, the voluntary services provided to the family, we had 167 of those. And then we opened into Amy and Michelle's unit 239 cases where ongoing services were needed, where we just couldn't wrap enough safety around the families in our first initial time frame. Go ahead, Michelle.
So this next slide is our placement, our number of out-of-home placements and the costs that are associated with that. You know, if you look at the numbers, we have less children of, the unduplicated children. So that means this number isn't repeated. Some kids come in and out of placement. So we had 229 unduplicated children in out-of-home care at any point in 2020, which is down from the previous year. But then you look at our cost and that's went up. And I think that had to do with a couple things. COVID really put a damper on our reunification efforts. Courts got delayed, services got delayed. We had a number of kids in residential treatment centers that weren't able to work their programming the way that they typically would with reunifying with parents. So I think that really increased the cost as far as that goes. And then I think, were you going to maybe mention how many we had adopted out? And
Yes, so currently, right now, as a point in time today, we have 139 children in out-of-home placement in Clay County. In 2020, we did 10 adoptions and 13 transfers of permanent legal and physical custody. So either it be to relatives or to significant relationships to the children. Currently, right now, we have 22 children on a trial home visit, which means the county retains legal custody, but the kids are at home working on fully reunifying them home. And of those 22 kids, that's only 6 families. So that just shows the significant amount of sibling groups that we've had over the last year. I know there was some discussion earlier regarding daycare costs with our placements. Over the years, we've seen a trend where a lot of our foster parents work outside of the home. Historically, we had a lot of foster parents who stayed at home and just took care of the kids, but recently, over the years, we've seen an increase of the number of foster parents who work outside the home, so then are needing daycare for those foster care kiddos. We have seen a decrease in that over the years of our costs, just because we have been able to tap into early learning scholarships for children. So we're able to provide scholarships for foster care kiddos who are needing daycare during the day. That program is through the Community Action Partners Lakes and Prairies. So we have been able to tap into those resources. But we do continue to supplement, along with foster care payments, assistance with daycare for those foster homes that need daycare for foster care children.
so some of our community partners and committees that we
Maybe
work with.
Before we go there, can I, on the foster care, are we meeting our needs in that regard?
As far as current licensed foster homes, I know, I did just talk to the licensor before I had come over, and she said she does have several new applications, but it continues to be a need that we do continue to need foster care homes.
And I guess that goes to a follow-up comment. As you mentioned years ago, foster families, they used to be, that probably was what they did. And solely what they did was being foster parents, and of course they would be compensated for that. Now, and I think we have publicly, over the years, have been basically asking for more families to get involved with foster care because the need is there. And I can certainly understand that because of that, some people are willing to do it, but they can't do it solely on an income level that they would get for being that foster parent. And so they still need to have their own jobs. And that goes to Commissioner Gross was the one who asked the question before, well, if we're paying them for foster care, why are we paying them for daycare too? And I think that's the new dilemma that we're in, and because of the needs. That is still a more reasonable price than the alternative, I think. So I wanted to throw those comments out there, but yes, Commissioner Kaylee.
On that, with the need for foster families, can you just talk briefly about what a foster family can and should look like? Can single people do it, just so the public is aware? People might not know what makes a good foster family if they're considering it.
Yeah, I mean, it can be we have single parents, we have couples, we have just anyone can apply and become licensed. The process is a little bit lengthy because there's background checks, there's additional training that needs to be done so that, it probably takes anywhere between 2 to 3 months to get fully licensed from start to finish. But I know that they're trying to do that training as quickly as possible and go through those processes so we can get those homes licensed quickly.
And people can live in a home, they can live in an apartment, they can license any structure, basically. I mean, there are certain requirements that your house has to meet, but you don't have to live in a house or, to be a licensed foster parent either.
Is there what kind of a time frame does a foster child spend within a foster home? I know that can vary quite a bit. Are we talking months, years, or a combination?
Well, usually the timeline from a time the child goes into placement, we do have 1 year to try to reunify that child home. It can go sooner if the parents are actively working their case plans. It could be within 4 to 6 months. It could be longer, dependent on how the case plan is going.
And we also use those foster care homes for respite care for kids to try to prevent out-of-home placement through either children's mental health or child protection cases. And with our lack of having foster care homes in the county, that's kind of been a detriment to us, I think, in some of our case planning, because we haven't been able to find these homes to kind of give parents relief when they've needed it. So I think that's important too. So you could be a licensed foster parent and do respite care. You wouldn't have to have a kid with you full time.
We'll touch on it later as well in the presentation, but we reach out to family too. If we're looking at a mom and dad and we have an uncle or a grandma and grandpa, you bet we're calling them to say, is this something you guys would be interested in doing?
Trying to keep it in family.
Keep it in the family, yeah. We know kids do best when they're with moms and dads. If they can't be with moms and dads, then we want them to be with relatives if possible, yeah.
And we have had situations where families got licensed specifically for a relative, and then they've kept their license open and then done care after maybe permanency has been reached for the child that they had in their home, so.
So going on to our community partners and committees. So we have a lot of community partners. This is just a, just kind of a brief list, but our child protection team is a multidisciplinary team that meets once a month with the court, or with a variety of people. Quinn kind of runs that team, but that's where people can come and bring any concerns if they want to staff a case. He brings a lot of education to those people too. Our Children's Justice Initiative, or CJI, that's with the courts. That's held once a month too. And that's where court, people from the county attorney's office, judges, social services, guardian ad litems meet to discuss issues that are going on through court. We partner with the Advocacy Center. We do all of our forensic interviewing there. The domestic violence team and the sexually exploited youth team, I believe, meet once a year or quarterly. We did recently have 4 staff go through Train the Trainer for the Stand to Protect campaign. And really that curriculum is really focused on ending child sexual abuse. It's kind of been put on hold. We haven't held as many trainings in 2020 that we had before, but that was kind of an exciting thing to be a part of. Our Parent Support Outreach Program, that's a program that we contract with the village for. We refer cases, so if Quinn's unit screens out a child protection report, we refer it to Parent Support Outreach, which is an outreach program to try to prevent people from coming into the child protection system. So some of our current challenges that we wanted to talk about, you know, COVID and its impact on our work. You know, we were given waivers when this first rolled out where we could do virtual visits with kids in foster care. However, we still had to go out and assess safety. So we've had, from the very beginning, our staff really hasn't changed in the fact of going out and seeing clients face to face. It has relieved some of ours where we have kids maybe in foster care home. We have a requirement to see them once a month, and we can do that virtually now. So some kids, if we have in the cities, if we can just do a monthly visit virtually, we're allowed to do that right now under the current waiver. And I just want to say, you know, I'm really proud of our staff. You know, they didn't skip a beat during this very beginning of COVID and all the unknowns and working remotely, and then what does that mean for child protection staff? They just rolled with it, and I really couldn't be more proud of how they handled this past year and really focused on providing that service to the family.
I'd like to piggyback on that too. My investigation staff, the ones that are going out right when we get the calls, if anything, the exemptions that we were given for COVID to do virtual visits, if anything, my staff had a problem with that, to say, how are we supposed to assess for immediate safety if it's through a Teams call or through a Zoom call? We need to be in the home, we need to see the environment, we need to see the parent-child interaction. So I could not be prouder of kind of how they're viewing the work, even with this challenging COVID crisis. I'll kind of move on to the next challenge. Staff turnover continues to be an issue in child protection. I think historically it just always have. It's really hard work. What we see out there takes a toll. We talk about secondary trauma all the time. We had 5 staff have either left the county completely or kind of moved to other divisions within social services in 2020. Again, with the turnover, I feel like we're in a constant state of always training new staff. One of the exciting things that's around the corner is we were accepted by DHS into a pilot program about training competent child welfare workforce in the state of Minnesota. We'll be starting that here at the end of April. Hopefully this pilot program for DHS will help with some of the coaching attributes that come along with training new staff in really developing their practice and engaging with families successfully. One of the things that the research tells us is that the relationship that a parent has with their worker is one of the best predictors of success. So for Amy, Michelle, and I to be able to train our staff in the best ways to engage with families, to create a good partnership, hopefully will yield to better outcomes for the families at Clay County.
Currently, right now, our agency is on a performance improvement plan for relative care. Our current standard is 35.7 of days spent in foster care with a relative. Some of the challenges that we have seen with this is being a border state, so oftentimes we may start a interaction with a family and all the relatives reside in North Dakota, which requires us to go through the interstate compact process to place those child with those relatives over in North Dakota. So what we have done, and we have seen improvement from this. In around 2014, we were at 16.4%, and we're currently up to 30.8% in 2020 with our goal of 35.7. So what we have really worked on over the last year was seeking out relatives prior to placement, like building safety around these families prior to the kids being in care. So if it gets to the point where the children have to go into care, we've identified those relatives and they may be able to step up, be licensed. We may be able to make arrangements or get those children placed with those relatives quicker right out of the gate. Thanks to the board, we've added a new case aide who's focusing on relative search, and we've developed a new procedure to try to track that relative search. And then finally, we've just looked at moving kids to relatives sooner despite barriers. What we've often seen is the parents reside here, but the relative is in Brainerd or Bemidji, and then you have the barriers of how do you keep reunification going, how do you keep visits going, how do you keep services going. And so we've worked with some of the tribes and with other agencies to try to get those kids to relatives sooner right out of the gate. So those are kind of the areas we've been working on.
Mm-hmm. And then wrapping up, a current and existing challenge is just truancy and educational neglect in our community. This is an ongoing problem, and this year has quite frankly been horrible with COVID. Trying to have the families and the children figure out distance learning when some of us even struggle with the remote working and everything like that. We don't have a great, the families don't have a great IT department like we do here. So really partnering with the schools to try to figure out the best ways to get kids to participate in school. I think even one of the challenges is when the kids get to school, what are they doing when they're in school? And this year's been particularly difficult in they're logging on the computers, but not doing their assignments. So it's just been a challenge when you have parents that are trying to work during the day and have, you know, young kids or older kids taking care of younger kids and expecting older siblings to teach younger siblings. Hopefully next year we're back to some sort of semblance of normalcy when it comes to that. So we can just have, I guess, the regular challenges that come with truancy and educational neglect. But it continues to be an ongoing concern that we're trying to fix.
That's all we have on our slides. Any questions or?
Comments?
We can't have explained it that good. Someone has to.
You did well.
Mr. Chair,
Yes, Commissioner Mojo.
I have some
Go ahead.
fairly close. As someone who's followed this fairly closely because of being on the out-of-home placement committee, I just want to tell you how grateful I am to you and your staff for the work that you do in this. This is an incredibly difficult area, and I know it's very stressful and straining, and I want to offer my gratitude to you all for what you do. So thank you very much.
Thank you. Nice report. I mean, it was well done.
Thank you.
Sometimes it's not the greatest of information that we have to hear, but it's. All right, we will take a 5-minute break. All right, we're back in session now, and we're going to talk about the selection of a construction manager position for our recovery campus. Kirk?
Thank you, Mr. Chairman. We're taking one more step. This is a fairly significant step, so I'm pretty happy about this. Last week, we narrowed, the week before, we had narrowed down construction companies for interviews. And we interviewed 4 construction companies last week. When I say we, the interview panel was Commissioner Campbell, Commissioner Mojo, Steve Larson, and then from my Solid Waste Management Advisory Committee, there was Roger Richmond, Everett Nelson, and then Shannon Thompson and Matt Comstock with Burns and Mac, and myself were there for assistance. Matt Evans. I'm sorry. Mr. Matt
His
Evans.
last name was Comstock.
I got ahead is what happened, so. So the firms that we interviewed 4 firms. We interviewed Comstock, McGow, Construction Engineer, and Donler. It was really very competitive, I think it's fair to say, and I think everybody will say that as well. And I think any of these firms probably would have done a really good job for the county. So I just want that to be known. Upon review and consultation among the entire group, it was a unanimous decision to go with construction engineers as being the contractor. So with that, we'll stand for any questions you all may have. I think that maybe Commissioner Campbell, Commissioner Mojo, if you wish to weigh in, you can as well.
I do want to concur with Kirk that those 4 applicants, they all could have done a good job going forward. As we kind of scored them, I think it was quite clear that construction engineers kind of rose to the top of everybody's list of the applicants. Most of them are very well prepared for the conversation and the interview. We spent probably about an hour with each of them, and most of them really did their homework. And we're lucky that we had those folks there. So it certainly was the interview committee's recommendation to this board to recommend construction engineers. And I think, what's the term we need to call them, Steve, for? That's the contract that we would be. Okay. I don't know, Commissioner Mojo, I'm sure you have something to add.
I do want to say that I really appreciate Kirk and your staff for preparing everything so that we could have such in-depth conversation last week. And I agree, most of them were really prepared, and it really became quite clear that the best benefit for Clay County would be to work through construction engineers. They've done great work for us in the past, and I'm excited about the possibility of work, or the reality of working with them on this. So thank you.
Okay, yes, Commissioner Ebinger.
And just to kind of join the consensus here, but my experience with construction engineer in the building and law enforcement center and the correctional facility was good. This is not an unknown quantity, so it's great. When I heard the participants, I was going, well, there's only one I know about, and that's a good one. So,
And I do want to follow up. So one of the questions that we asked all of them, and it was pertaining to fees, and they all kind of had slightly different presentations on how they would handle their fees. In the end, we felt that when you put the entire packages together, we didn't see any real significant differences between them in terms of what their fees were. So I think if part of your decision is going to be based on the potential fees, I think I can share with confidence that they were all fairly close, and if they weren't, they were somewhat, we were kind of in limbo in one or two instances about where they were going to go with their fees, or some included some things and some didn't. Some fell within the scope of a percentage, and some of their work wouldn't have been part of that percentage. So overall, I think we were pretty confident that they were all fairly close fee-wise. So again, I think it did go to what you said, Commissioner Ebinger, that we certainly have had a really good working relationship with construction engineers on our other projects. Of course, Comstock, we've had experience with them at the landfill, and they've also done very well. So but we can only choose one, and that was the recommendation. So at this point in time, we're looking for a recommendation to go ahead, and I think what we would do is the motion should be to have our county administrator work closely to establish a construction management at risk contract with construction engineers.
I will move to approve that recommendation.
Okay, we have a motion by Commissioner Kayla.
Second.
A second by Commissioner Mojo. Any further discussion? Any questions? Seeing none, roll call vote, please.
Commissioner Kaylee.
Aye.
Commissioner Gross.
aye.
Commissioner Mojo.
Aye.
Commissioner Campbell.
Aye.
Commissioner Ebinger.
Aye.
Thank you very much. I just, one last thing, I wanted to thank commissioners and Steve and the folks from the Solid Waste Advisory Committee. Spent a whole day basically, and I know it's commissioner's job to go to meetings like that, but it's still just quite a commitment, and I really appreciate you making the time for that. So thanks to all of you.
I think, as Commissioner Mojo said, detailed planning and getting preparation by you and your staff and Matt help make that go smoothly. So thank you too for your work.
Thank you.
Okay, now we'll go into our committee reports, and Commissioner Kaylee, we'll start with you today.
All right. On Tuesday, March 2nd, there was a special meeting of the Historical and Cultural Society of Clay County Board to discuss talks between the city of Moorhead and the center there. Those are still ongoing. On Wednesday, the 3rd, the Moorhead Planning Commission met, and we approved this one. A request from Enclave Development for a conditional use permit to exceed the height limit on a commercial mixed-use building on 30th Avenue South. We also approved the final plat for the Prairie Parkway First Edition and a request for a conditional use permit for a self-storage facility on 8th Avenue North. There was also an approval for rezoning from neighborhood commercial to community commercial in relation to a property on 12th Avenue South. And right across the street, there was some other commercial properties, so it's not going to change the feel of that area very much at all. Then on Thursday, the 4th, we had a joint powers meeting. Kevin was at that as well. We reviewed the intergovernmental retreat survey results and discussed some ideas for next year, as well as had an update from Jamie about COVID and how that is being addressed. That same day, I had a local advisory council on children's mental health meeting. We discussed the transition for that group after Carolyn Sternad retires. We had an update on how the parent and provider surveys on children's mental health are coming in, and how we can make sure we're getting really good results for that survey, which should be presented to this board in May. Lakeland noted that they are hiring. They're very busy, Lakeland Mental Health. Friday, March 5th, was the CAP-LP, which is our Community Action Partnership of Lakes and Prairies. They did their Head Start self-assessment, and that was really interesting to see how their numbers had changed in light of the pandemic and stayed the same as well. I'm always impressed with our Head Start, but this year particularly, their statistics were really great, and the ways that they've adapted to keep connected and serving families was just really inspirational. Some of the things they noted in that self-assessment was the behavior issues. Families were noticing that behavior issues with their children had increased very understandably, with these kids being stuck at home, and lots of times without getting that outdoor play and that gross motor play and interaction with other children. So that's partly what's probably behind some of those behavior issues. A lot of the parents also noted that they were feeling disconnected from other adults. And traditionally, Head Start has had lots of parent groups and stuff that have met, and that's just looked a little bit different this year. But interestingly, that number of parents reporting that feeling of disconnection has been fairly stable over the years. So I think it might speak more to a greater societal issue than something in their work with those parents. Also of note from that is, due to the connection that CAP-LP and Head Start has with these parents, they have remained very stable over the course of the pandemic. They're getting their housing assistance that they need, their WIC, their SNAP benefits. And so the impact to these families was, not to downplay it, but because that safety net was there, they were okay. They have come through okay so far. So kudos to Capital P and to Head Start for the incredible work that they do in our community. On Monday, March 8th, I had an Economic Development District meeting with West Central Initiative. We approved the revolving loan fund reuse plan, and Marcia Erickson presented information from their child care wage and rate survey. So prior to the pandemic, we already had a child care crisis in our area, and the pandemic exacerbated the issue. One of the things she noted in that survey was that the median wage in our area is $60,000 for a 2 working parent family. And childcare costs for a child in a daycare center is give or take $1,000 from $10,000 a year. If we're talking about an infant, a toddler, or a preschooler, it's roundabouts $10,000 a year. Economists say that families should pay no more than 7% of their household income towards childcare costs, and yet for a family like mine, a family of 5, 2 working parents, 3 kids, some of these families are paying 50% of their income just in childcare costs. So I think we need to advocate for some changes statewide to address this issue. Also, that same day, I attended the Community Resiliency Roundtable put on by AMC, the League of Minnesota Cities, the Minnesota School Board Association, Minnesota Association of Townships, and the Minnesota Service Cooperatives. Childcare was another topic that came up in that, and we talked about a lot of similar things and ways that we can work together towards addressing those issues. Also, on the 8th, Monday the 8th, I had a law library board meeting. We reviewed the financial reports and the Westlaw terminal usage statistics. Colin, our staff member in the law library, gave us an update on the legal kiosk training, so that's all ready to go. He's working on policies and procedures for when the law library does eventually open up beyond its current by appointment only basis. We reviewed bylaws and discussed possible changes as well. That concludes my report.
Thank you, Commissioner Ebinger.
Thank you. Thursday, the 4th, we had a virtual meeting, board members of the Diversion Authority, with the virtual meeting with Senator Klobuchar regarding moving ahead with financing and funding on diversion. Initially, the senator had expressed some reservations through this program, but she feels good about where we're at now with the settlement that has been reached and the DNR approval of the project in Minnesota. We discussed some of the issues about getting this into the president's budget, and she was very positive on it, and it's going to be an ongoing process, but everybody left the meeting feeling pretty good about where we're at. Later that day, I was part of a mental health working group that's been put together by Chief of Police Shannon Monroe here in Moorhead and Pastor Sue out at Churches United. This was precipitated by a number of violent encounters that they've had over just the last short period of time, 6-8 weeks. They've had 4 or 5 times where staff has been assaulted. Officers have had to fight people. There's been damage inside the intake area of their facility, and it's a result of people who are either unstable, in mental health crisis, have taken a large amount of drugs or both. And we discussed the facilities problems that we have. Our community here really needs more beds in a stabilization unit for people who are in crisis. A shelter environment is not adequate. And it's pretty much the same issues that we faced when we looked at building our correctional facility, where we had to put in place a part of that facility directly for people in mental health crisis. The shelters are experiencing the same issues. This is a very good group. We've had people from our public health here in the county. Councilmember Lindis from Moorhead City Councils is also on this, with people from Summit Health, Sanford Health, Essentia Health, the State Department of Human, DHS, just a good collection of people. So the discussion's taking place. I think one of the issues that we as a commissioner are going to need to include on this, a lot of the problem is dual diagnosis. People that are in the community who are either self-medicating, who have mental health issues, and you don't know whether you're dealing with somebody who's ingested a lot of drugs that make them act psychotic, or whether it's a real psychosis, or both. And I think our detox center is going to have a key role in this. There are stabilization units that'll take people, but they have to be sober, and so that they can identify what the mental health issues really are. That's not the complete answer, but I think it's part of the picture that we need to look at. And I'll continue to keep the commission informed on this. And that concludes my report.
I had an opportunity to talk with Commissioner Ebinger a little bit about this, and I think the time commitment, and I think if there's a formal group that's been put together, and I think with Commissioner Ebinger's background, and with his background, we have commissioners kind of in different areas regarding mental health issues, and I hate to complicate or duplicate a lot of those things, but I think it's if there's been an established group to do this, and we have a commissioner that's willing to be involved with that, I think we should consider adding that to his portfolio, and so we can get regular updates on that, and it's kind of an extra time commitment on his part. So I would suggest that we maybe add that. Does it have a formal name? Does that group have a formal name?
Yeah, right at this point, it's simply a mental health working group. They are keeping minutes, and there is county staff involved in this, so.
Okay. I don't want to confuse it with the work that you're involved with. I think you have some mental health things, and then also I know Commissioner Mojo has been involved with the mental health component with our correctional facility. So somewhere along the line, these things got to come together, but I do believe that we should authorize you to have that as part of your portfolio, that mental health working group. So it would be like members of Cass and Clay County?
Yeah,
beyond that?
Well, we don't have Cass County. That's one of the things.
Well, but you mentioned that you had Sanford and Essentia people, so.
Yeah, and we have Moorhead City Council represented.
Okay.
You know, I think the component that I was drawn into when I was contacted over was, I do have a background setting up a stabilization unit for the Little Rock Police Department. And, of course, law enforcement experience, and a lot of this is our safety issues. And where we have law enforcement response in an area where we need stabilization and treatment of people in crisis. So having a background in that, I was brought into the discussion.
Excuse me.
Commissioner Gross.
Why I should have been listening. I just at the one meeting,
No, wait, no, I guess.
excuse me.
Before you
excuse me.
go, I just want to, again, I'm kind of looking for a motion.
You're looking for a motion to add that to this committee? Or?
Right.
So move.
Okay, we have a motion.
Second.
Commissioner Gross, second by Commissioner Kaylee. Any further comments?
The only thing I have, I think this is beneficial, is just to make sure that we don't have out of committee overlap, because so many of us are on mental health
Right.
committees. I'm with Lakeland and Lakes and Prairies, and like you said, the correctional facility. We just have to make sure that we're not breaking protocols.
That's exactly what I brought up, but I think this one is kind of a unique, and it deals more with, law enforcement issues related to it, and I think Commissioner Eberdinger will have to be sure to follow up with what these other committees are doing as well, so that we don't just duplicate or counterproductive to what the other groups are doing. That's the concern that I have. So.
That was part of our discussion. I'm sensitive to that, and I'll make sure that other players are kept up to speed on what's going on, and that their concerns or inputs reflected in how I approach this.
Okay.
That was just what I was doing when you asked me. I was looking at the sheets to see whether we're not duplicating some stuff here or not.
Right. And it can give that appearance.
Yeah.
That it is. So we got to be careful there. That.
Okay.
All right, Colleen, let's do a roll call vote, please.
Commissioner Kaylee,
Aye.
Commissioner Gross,
Aye.
Commissioner Mojo,
Aye.
Commissioner Campbell,
Aye.
Commissioner Ebinger.
I'll just be present on this since it involves me.
Okay. Does that conclude your report?
Yes.
Okay. Thank you. Commissioner Gross.
Yeah, at the one meeting, and that was with Minnesota rural counties. We met mostly on the clean car rule that they're trying to adopt in Minnesota. They're trying to use the California standards. And we had a couple of people, Angie Beardahl from Clean Up River and Environment, and Jola Baines from Fresh Energy. They're both advocating that Minnesota adopt this thing. Pretty much on the MRC board, we're sort of against it, I guess, because adopting California's rules into Minnesota just doesn't work. It may work right in Minneapolis, St. Paul, but it's not going to work out in rural Minnesota. And there was just a lot of discussion on putting up a resolution or whatever, whether we want to support this or not. And some of the counties have already said they're not going to support it. So I don't know whether any of you guys have got anything on the clean car rule yet or not, but that's going to be coming up, and we're going to have to either support it or not. I mean, right now, as far as the MRC, I don't think we got any support or no support for it so far. So probably because we're all rural areas on that committee. So like I say, probably in Minnesota, but they're looking at the cost of vehicles. I mean, we're supposed to be all electric, not all electric, but I think 35% a year, 2035 or something like that. But that's supposed to be more, everybody be buying electric vehicles, and they're looking at the cost of the batteries, loss of gas tax and stuff like that. So, and other than that, that was my only meeting, but I do have a couple other things. That 5-year plan, since we're not going to have highway planning this week, we're going to do it next week. Did we have a date set up for that 5-year plan? Because I'm getting called.
I think we have that set up as part of our is it the 23rd? It's going to be just part of our regular
Meeting on the
agenda.
23rd, okay.
Yep.
All right. Then the next thing I think we'll probably be discussing, I don't know, we're having a meeting on April the 8th, I think, but that's for cities, isn't it? Rural cities?
Yeah, small cities.
But we're getting, I think there's going to be a lot of questions coming up on the Spring Prairie Township authorizing the Hutterite Colony to request becoming a city. So I think we need to have, I don't know whether we need to have a discussion with some of those townships around there, because I'm getting calls from townships surrounding there, as far as how it's gonna affect them and stuff like that. I don't know whether we have to put something out, or whether Matt should put something out to the surrounding townships, or it's gonna affect the whole county, but, I think that's gonna be a very important item coming up there. I don't know if it's gone through, I don't think it's gone through planning yet, has it, Jenny? That how to write stuff is,
It has not gone through the Clay County Planning Commission, just the Township Commission. My only comment on that is, yeah, I think we definitely should bring it up at the small cities meeting and discuss it, but in terms of a township discussion, that might be something we want to have a special meeting with just townships. You know, they did cancel their
right?
spring
Yeah, I agree with that,
meetings.
because that's what I was saying, that this meeting April 8th just for the city, so I don't know whether we need to have a township meeting ourselves, because they canceled theirs. So, we need to get something out there to them. I think Matt is going out to Keene Township, next Monday, because they requested information on it.
You know, I think we did have a little bit of a conversation regarding this during our comprehensive plan meeting last Friday. Just there was a little bit of discussion about it. It was brought up there, and I think I do like your idea that we should certainly get some feedback. I know the process it's basically a petition that goes before an administrative law judge. I believe it's the chief Minnesota law judge, and and whether or not the county is going to voice an opinion. I think we should get an idea in terms of a time frame. I see Matt's here now. I don't know how long an administrative law judge has to make a determination on there, and when what they will allow for comments during that process. One of the issues that was brought up was maybe the petition is a fairly large geographical area for it to become an incorporated city. And do they really need that much geographical area is something that might be of interest to the county, amongst other things. So I don't know that we're taking a position for or against whatsoever, but I do believe that we should hear from townships and then make a determination ourselves if we have concerns, and if those concerns should go to the administrative law judge for a decision. I think that's just should be a common practice on our part. Without being for or against right now, I don't have enough information to go on, but I think it would give us an opportunity to hear from townships and what their maybe there's proponents and opponents to it. We don't know.
I don't know which way to go on it, like you say, no decision has been made on it yet, but it's gonna take at least four townships out of the taxing. I mean, it's gonna put them into a city.
I think, Matt, you described it would be the second largest municipality in the county in terms of geographic area. So, that seems like an awful big geographic area for
I've got a copy of it.
for such little population, I
If you
guess.
guys wanna look at it, but it's 4 townships at least.
But maybe Steve, could you work on something on behalf of us so we could, if the townships want an opportunity to come here and talk about it, we can arrange that through a normal, just like we're doing with that highway deal. We could have it part of an agenda item to let them come in and talk, or they can do it virtually, whatever they want to do. But the more input we can get, and do townships want us as a county to weigh in on it with the administrative law judge? I don't know, but we won't know if we don't hear. So
That's it.
okay, thank you, Commissioner Gross. Commissioner Mojo.
Thank you. Last week I attended Extension Committee interviews for the Clay County 4-H Youth Development position. That was an all-day interview panel. I think they have good applicants to choose from going forward. We'll see how they fill that. I also attended the Solid Waste Committee contractor interviews. I believe that's been covered in detail. And then last night attended the Buffalo Red Watershed District board meeting. Fairly good discussion on several issues that are coming up. There are a number of ditch hearings and buffer strip hearings that will be happening. In sensitivity to the COVID environment, they're trying to space those out over a variety of different nights. So if you could go on the Buffalo Red website, you can see which specific ditches they'll be having hearings on, if that applies to anyone. Those meetings start on Thursday at 6 o'clock. The other item that they had discussed a little bit is the Diversion Authority lawsuit contested case piece, but also making sure that they are provided information as it comes up in regards to the need for permitting any pieces. So as two of you sit on that Diversion Authority, make sure that they are being forwarded information in a timely manner. Another item that is of note is that they did have discussion to use parts of the Oakport Prairie and use it for conservation biology courses. I believe that's through one of the colleges in town. There was a pretty good discussion on that that resulted in a favorable vote to allow that. I think that continues to be an asset of these county-owned properties that we have because of buyouts, that we can allow universities and students to get in there and do some work and study on them. But that then concludes my reports, Mr. Chair.
Thank you, Commissioner Mojo. Okay, so my reports are Wednesday, we've discussed thoroughly the solid waste interviews that went on. Thursday morning, Commissioner Kaler reported on the Clay County Joint Powers meeting. I really don't have too much to add on that. I do want to thank Jamie Hennon for taking the time out of her extremely busy schedule from Public Health to give updates for that group. We continued to talk about topics. There's been some sort of consideration given to the next year's retreat. However, I suggested that it'd probably be in our best interest to be non-committal at this point in time because of the rapid way things change, and what might be hot topic right now might fall to a lower level just from the unknown. So I think we'll deal more with that planning phase starting. We take the summers off on that group, but starting back in September, we will work on that. Friday afternoon, we had our county comp plan meeting. It was a good meeting. Matt's doing a good job along with MetroCog and arranging those and the process going on. And we keep getting more and more information. I do want to point out that on March the 23rd, we are having 2 open houses regarding the comp plan for the public to attend virtually. The first one is from noon to 1, and then the second one will be from 5:30 to 6:30 on that same day. So we have there's some questionnaires that have been going out now. We sent a letter out, Matt sent a letter out yesterday, I believe it was, on behalf of us to encourage townships. We gave them a series of questions that we felt are important to get their responses on. And so with that, I don't know, Matt, do you have anything that we need to talk about there that, no? Okay, all right. Okay, so then yesterday, I did have an opportunity to go up to, and it's not part of my committee, and But I do want to mention that I spent about an hour with a presentation on, with public health regarding e-cigarettes and some of those things that are going on. I know there was presentations given to the Moorhead City Council and the Dilworth City Council last night. There was some kind of alarming statistics coming out there dealing with youth. And I think it's important that our board hears about those. But I believe both of Commissioner Cayley and Commissioner Ebinger have seen this report through committees that you're on. I encouraged Rory to reach out to you, Commissioner Gross, and Commissioner Mojo to have an opportunity to take a look at this.
I've already set up a meeting with him.
Very good, okay. And I think it'll be good, and I know that there is being a request before the Moorhead City Council and the Dilworth City Council where they're actually holding public hearings. I think they're scheduled for the latter part of March, and I told them it'll be interesting from our part to find out feedback from those public hearings from those larger communities. Certainly it doesn't apply nearly as much to county because, well, it would for all the communities other than Moorhead, Dilworth, and Barnesville all have their own established mechanisms for that. So everybody else, and then even in the rural areas. Unfortunately, we don't have any smoke shops or anything like that in rural Clay County. However, there is the ability still to sell some of that product in some of our other service stations or what have you. Do you want to comment on that?
And just a lot of and it's state legislation that's under consideration too is going to be flavored tobaccos, and that includes menthol. And universally, it seems the major concern, and rightly so, is a highly addictive nature of vaping. And that, you're not putting bubblegum flavored vape out there to attract adults. And there seems to be a pretty widespread effort to legislate that into something that's manageable.
Well, I'm sure we'll, I've told them that after they are able to give the presentation to Commissioner Mojo and Commissioner Gross, that we would consider then putting it on as an agenda item for an update to the full board. And I don't know, Steve, if you have an opportunity to sit in on one of those with Commissioner Mojo or Commissioner Gross, I think that would be good too, as our administrator. And lastly, I just want to make mention that I've been reviewing currently what the intentions are for the federal funds under their most recent $1.9 billion or trillion dollar federal government. And I noticed in there that one of the areas of that will be allowable expenditures for counties will be broadband. So I just want to follow up again. I know we had this discussion not too long ago after that presentation, and I really think that we need to be, before we bring back our CARES meeting and all this stuff gets going again, that we had talked about getting those detailed maps of Clay County by township. And I think it would be good for us to expand on that, Steve, and to maybe request that data so that we have it readily available as this process. I'm assuming that it sounds like by the end of this week that thing could become law, which then I think they mentioned that counties could start seeing our first distribution within 12 weeks after that, I believe it was. And I think broadband has been an issue for us, and if this gives us an opportunity to improve that in some of our areas, we should be doing our homework, and so that's ready to go. That concludes my report. Steve, do you have an update for us?
Thank you, Mr. Chair. Last Tuesday after board, we had some discussions on the incorporated city with Matt Jacobson, Brian Melton, and a number of you as commissioners. On Wednesday, we had county management. We received an update from Kathy. We talked about the new budget forecast and the government center. On the third, that afternoon, or morning and afternoon, I participated in the CM at risk interviews. And again, just to echo what a great, fortunate to have qualified people, candidates to interview, and also what a nice job Kirk and Matt did in preparing for those interviews. On the 4th, I participated in the joint powers that has been covered already by Commissioner Catley and Commissioner Campbell. On the 4th, I had conversation with Sheriff Empting, Brian Melton, and Commissioner Ebinger on the deadly force statute. Again, there's been some changes to that statute in Minnesota, which has impacted some of our relationships with North Dakota law enforcement. And there are going to be some continuing conversations on that, and especially in areas where we share our SWAT teams or drug task force. And ensuring, I think we're hopeful that additional conversation and education will change some of the concerns that North Dakota has about making sure that they're actively participating or continue to participate in those groups. On the 5th, I did talk with Rory Beal and Jason McCoy on the flavored tobacco issue and had some conversation there. That afternoon, I had a department head evaluation and also worked on some things for the government center, and lastly participated in the Clay County Comprehensive Plan. On the 8th, yesterday I met with Ted Priester, Executive Director of the Red River Basin, and also April Walker from A. Walker Consulting. They've been working, the Red River Basin has been working in conjunction with A. Walker Consulting and Bar Engineering to update our long-term flood study. And they've been working through an MPCA grant, and that study is due at June 30th of this year. And so we're working with some additional cities within Clay County. It's not just related to the red. It's a comprehensive look at our whole county. And so I'll be reaching out to a few of those cities in hopes of them providing the information to Ms. Walker.
Hey, Steve, can I interrupt you for a minute? While you're talking about that flood study, Matt, I had a call from somebody who's in the area of the Buffalo where we've had that, and I think the intent was, or what we're seeing, is that some of those properties will be removed from the 100-year floodplain through FEMA. Did you get a chance to talk with? Did somebody call you on that? Yes. Okay, I just wanted to follow up on that. Okay, sorry, Steve.
That's all right. And then yesterday we spent much of the day moving over to the government center from the HR and administration are now located there from a citizen standpoint and our department standpoint, that we're no longer located in the courthouse. I did an interview yesterday afternoon with the extra on the government center. And I think when it comes just to the moving piece, again, I just want to echo what was shared about Joe and his staff. As far as moving, this process has gone unbelievably smooth. We're kind of doing things in a phased approach. Next week, we'll be looking at moving our auditor techs out there. In the week of the 22nd, we'll begin moving our land records departments. Again, our goal for our citizens is that we're going to continue to provide service here at the courthouse through the 26th. And when we open up on Monday and the 29th, those departments will be located in the new government center. And so we do have updates on our webpage, and we'll continue to do that. We're looking at providing a news release to the media, and also we'll be looking to we won't be doing a ribbon cutting necessarily, but we'll provide an opportunity for the media to walk through if they are interested. So that concludes my report.
All right. I see. Clean, do you have anything for us? Have a good week.